In this short video of the Nursing Mindset series, we're going to review one of the most important concepts you'll use every single day as a nurse, and that's communication. Communication is much more than simply talking to a patient. In nursing, communication is a clinical skill. Every conversation you have with a patient, a family member, a provider, or another member of the healthcare team has the potential to improve patient outcomes, or conversely, contribute to errors if communication is ineffective. As you look through this infographic, I want you to notice that communication touches every aspect of nursing care. Whether you're introducing yourself to a patient, documenting in the electronic health record, giving shift report, or teaching someone how to take a medication, you're communicating. So let's begin with the therapeutic nurse-patient relationship. Now, this relationship is professional, it's purposeful, and always focused on meeting the patient's needs. Unlike a social relationship, the therapeutic relationship exists to benefit the patient. Before you ever enter the patient's room, you're already communicating through your preparation. During the pre-interaction phase, you review the patient's medical record, you gather information, and you begin planning your care. When you first meet the patient during the orientation phase, your goal is to establish trust. You introduce yourself, you explain your role, you learn how the patient prefers to be addressed, and begin identifying their concerns and priorities. The working phase is where most nursing care occurs. You assess, administer medications, provide education, answer questions, and use therapeutic communication to help the patient achieve their goals. Finally, during the termination phase, you prepare the patient for the end of the relationship and safely transfer care to the next caregiver. This transition is just as important as the beginning of the relationship because effective communication ensures continuity of care and keeps our patients safe. Now, let's look at effective professional communication. Communication is one of our most important patient safety tools. Many preventable healthcare errors occur because information is incomplete, is misunderstood, or maybe even never communicated at all. As nurses, we have a professional responsibility to speak up when something doesn't seem right. This is called patient advocacy. Remember, advocacy means doing what's right for the patient. So here, when we're talking communication, advocacy means communicating changes in a patient's condition, clarifying questionable orders, and ensuring the patient's needs and concerns are heard. Professional communication also includes accurate documentation in the electronic health record, or the EHR. Remember the old saying, if it wasn't documented, it wasn't done. Documentation should always be clear, concise, objective, and factual because every member of the healthcare team depends on that information to provide safe patient care. Another essential communication tool you'll use throughout nursing school and your career is ISBAR. Most students often think of ISBAR as something we only use when calling a provider, but it's actually a standardized communication framework that helps organize information anytime you're discussing a patient. You'll use ISBAR when calling a provider about a change in a patient's condition. You'll also use it during shift handoff report to another nurse, when communicating with a rapid response team, or any other members of the healthcare team. You'll even use it when presenting patient information during clinical. Using a consistent format helps ensure important information isn't missed. So remember, ISBAR stands for I, introduce, S, situation, B, background, A, assessment, and R, recommendation. So for example, during shift report, you might introduce the patient, explain why they're hospitalized, summarize their medical history, discuss your assessment findings, and finish by identifying what still needs to be completed or monitored during the next shift. Whether you're communicating with a provider or another nurse, ISBAR promotes clear, organized communication improves teamwork, supports continuity of care, and ultimately enhances patient safety. Now let's talk about communication styles. So, a passive communicator often avoids conflict and may hesitate to speak up even when patient safety is at risk. On the flip side, an aggressive communicator focuses primarily on their own needs and may communicate in a way that intimidates or discourages collaboration. In actuality, the communication style that we strive for in healthcare is what we call assertive communication. Being assertive means expressing concerns clearly, confidently, and respectfully, while also respecting the opinions of others. Assertive communication is not being rude or confrontational. It's advocating for your patient in a professional manner. So whether you're questioning a medication dosage, reporting a change in a patient's condition, or asking another team member for clarification, just remember, assertive communication will promote a culture of safety. One of the most important skills that you'll develop is using therapeutic communication. So therapeutic communication helps patients express their thoughts, feelings, and concerns while building trust and strengthening the nurse-patient relationship. Examples include things like active listening, showing empathy, using silence appropriately, asking open-ended questions, paraphrasing, validating feelings, providing information, and summarizing important points. Now, in contrast, non-therapeutic communication often creates barriers. So things like giving advice, judging, changing the subject, arguing, or offering false reassurance may unintentionally shut down communication and discourage patients from sharing important information. Before responding to a patient, ask yourself this simple question. Will my response encourage this patient to continue talking? If the answer is yes, you're probably using therapeutic communication technique. Communication also requires us to recognize and adapt to each patient's individual needs. Pain, anxiety, fatigue, environmental distractions, language barriers, cultural beliefs, age, hearing or vision impairments, cognitive changes, and previous healthcare experiences can all affect communication. Our job is not simply to deliver information, it's to deliver information in a way patients can understand. That may mean speaking more slowly, reducing background noise, using simpler language, allowing additional response time, or working with a qualified medical interpreter. Effective communication is individualized, just like nursing care itself. Finally, communication doesn't end once we've provided information. We need to evaluate whether our communication was actually effective. One of the best ways to do this is by using the teach-back method. Instead of asking, "Do you understand?" ask the patient to explain the information back to you in their own words or demonstrate a skill you've taught. So for example, can you show me how you'll use your inhaler? Or tell me how you'll take this medication when you get home. Teachback doesn't test the patient's knowledge. It evaluates how clearly we explain the information. If the patient can't teach it back, it's our responsibility to explain it differently until they can. As you begin developing your nursing mindset, remember, excellent nurses aren't simply skilled at performing procedures. They're exceptional communicators. Every interaction is an opportunity to build trust, advocate for your patient, collaborate with the healthcare team, and improve patient safety. Communication isn't just something nurses do. Communication is one of the most powerful nursing interventions we have. See you in class.